Welcome back. I'm Dr. Sudha Reddy, a surgeon based in Hyderabad, and this is part 2. Today, we'll be talking about stomach pain and 2 other conditions that are common, treatable, but often caught later than they should be. Now, first, tummy aches. Tummy aches are extremely common. Most of the time, it's gas or constipation or even a passing cramp. It usually settles, but sometimes it doesn't. And sometimes it needs urgent attention. Here's a simple framework. Pattern 1. Constipation or gas pain comes and goes. The child still plays. You feel better after passing stool or gas, and this is usually manageable at home. But watch for pain that is not relieved. Pain whose frequency increases, the child stops playing, or if ever there is blood in their stool. Please see a pediatrician immediately. Now, pattern 2, which is more serious. This is pain that moves around from the middle to the right or the left. It gets worse over time. The child doesn't want to move and they cry when you press the abdomen. This needs same-day evaluations. Don't try and give painkillers, don't try and apply heat or something. Go to the hospital immediately. This could be anything from appendicitis, intussusception, Meckel's diverticulitis. It could be a number of things. You don't need to figure out which it is right now. You just need to identify the pattern. Other patterns that you should identify are pain with urinary changes. This definitely needs an evaluation. And recurring vague pain. Don't ignore it if it keeps showing up. Track it, find the pattern, and report it. Next, we'll be talking about inguinal hernias, a swelling in the groin that comes and goes. This usually appears when the child cries or strains and disappears when calm. It seems harmless, but it might not be. In children, there is a small passage in the groin that closes before or after birth. In some kids, this gap does not close on its own. The intestine enters the passage when the child cries or runs or strains and usually goes back. But sometimes it gets stuck, and that's when there is a risk that the intestine gets trapped. The blood supply gets cut off, and this becomes an emergency. If you see this swelling, don't wait. Go to your pediatrician. This is usually a very simple surgical procedure when diagnosed early, before things get complicated. Next, we have a common condition that is often missed in toddlers and toddler boys especially, undescended testes. In baby boys, before birth, the testes are in the abdomen and they descend into the scrotum by birth or within the first few months of life. If they haven't descended by 6 months of age, it is unlikely that they will descend on their own. One or more of the testes may still be in the groin or the abdomen. The reason this is missed is because from the outside everything looks normal, so parents don't notice that something is wrong. So how do you know something is wrong? Check when your child is relaxed, like after a warm bath. Feel for both the testes in the scrotum. You should feel a small, smooth structures. If one side is empty or you're not sure, see your pediatrician and they will involve a surgeon if required. Ideally, the window for surgery is between 6 to 18 months of age. But if you're hearing this now and your child is 3 or 4 or 5, it might not be too late. Get an evaluation from a pediatric surgeon. And the sooner you act, the more options you will have. Across everything that we've covered, swallowed objects, injuries, stomach pain, hernias, undescended testes, most of this information might not be information you will ever need. But if you or someone you know might ever need it, now you'll know what to look for. You'll know when to act. You'll know who to ask. That is not panic. That's not paranoia. That's informed parenting. I'm Dr. Sudha Reddy, and this is Coverage. Thanks for joining us.